Thank you, Abd, and thank you very much to everybody for listening to this presentation, which I've so far found extremely interesting. My name is Nadya Isack. I am a committee member of Obesity Empowerment Network, and probably more importantly, I'm a patient living with obesity. And that is the reason why I'm here to talk about, should I not say my story, but really about, as we've been talking about, stigma. Now, I have been through lots of times of stigma in my life, but what I've decided to talk about is what's actually already been referred to, and that is from the outside looking in. So basically, I'm looking at myself as a person living with obesity and trying to understand why my friends never said anything to me. I have a small family, so my friends are my family. And being super morbidly obese, not even 2 years ago, I did not understand until I actually opened a little window from myself and said, I've decided I'm going to have bariatric surgery and I wanted to tell you. And then they started coming to me, albeit very slowly, and said, we were worried about you. We thought that it was difficult to watch you walking up a hill and could only walk 10 steps and you were breathing very heavily. And something that also sticks in my mind is they asked me, why did I leave a festival we went camping on? They didn't understand. I said I was sick. However, I couldn't get off the airbed mattress on the floor. It used to take me about 5 minutes to actually get myself standing up. That was a very big turning point in my life. And I felt then I wanted to conquer that inner demon. And we've spoken about that referred to before. And I'm so happy now my inner demon has a name. It's internalized weight stigma. I basically considered myself exactly what the stigma of our social environment had said about myself. I had no self-confidence. I couldn't form relationships. I'm lazy. I cannot lose weight. Why can I not lose weight? Therefore, I'm not normal. So basically what happened then, if you wouldn't mind moving to the next slide. That was me 2 months ago, lockdown, taking a walk. And we were socially distanced, let me say, by taking the photograph. Basically, I wanted to talk that was possibly, it's a year and a half since I had bariatric surgery. And basically, I suffer from a huge stigma, which has been referred to again, is that having bariatric surgery or any pharmaceutical or surgical intervention is a cop-out. It's the easy way out. But what I would like you all to understand is that actually from my two different pre and post adventures, should I say, I'm finding this part even more difficult because I still have that internalized weight stigma, perhaps even more, because before I could put it on, I had a reason why people were saying that to me. I had no confidence. I was just eating and not moving. However, now, having had people come up to me and say, well, you must be happier now that you've lost weight. And one of the shockers was, well, now you can start dating. And to me, those things, post-bariatric surgery, post-weight loss, is what we need to look about. The mental health side of it is that without that support, without those 1 or 2 words that you can say to your patients that you come across, even once they've lost the weight, because regain is so easy. And to be honest with you, every single day, and which is something that again turns back to your friend's perspective, your family's perspective. When I walk through the supermarket, I avoid the aisles I know, which are triggers for me. And that will be an ongoing thing my whole life, because the reasons we go to food is just not comfort eating, as previously referenced. At the moment, I suffer from severe body dysmorphia. I really don't know what to do. I can't go into a shop and buy clothes. I can now, but I still cannot mentally in my head. So online shopping has been quite great for me. In figures then, at the weight that I knew I was the highest, but I assume I was higher because I never got on the scales, and I'm working in kilograms here. It was 164 kilograms. That was a size 32. And in that picture, I was resembling that. And basically what I wanted to just show you was that I am still the same person. And people who suffer with obesity, whether they still are obese or change their physical appearance, we are still the same person. and to actually say to you, you should be happier being thin, increases that stigma. So I'm not talking about stigma per se. I'm just trying for you to understand how stigmas last. And that comes to my final point, is that what can you do? What can you do when you are faced with that situation of somebody suffering with obesity? And that's where language matters. There's lots of information out there how you can speak to that person in the right context. And it does take bravery, it takes skill, and you may be shut out the first time, but then try again, because we all just want support. And with all the racial diversity that's abounding, and how to have those crucial conversations, I'd like to just point out one thing that hit me a lot when I was listening to another webcast was, we can all be allies, but allies, as I think it was, I'm not sure which speaker said it, you need an advocate. You need somebody to stand up and actually do action. It's all very well having consensuses and documents and policies, but you yourself as an individual, even if you say it once and you're in a group of your peers and one person is saying, gosh, I did some surgery on this person, they were ginormous, I can't believe it, how do they live? Stand up, say something, because it's a domino effect. I'd like to then thank you very much. I'm going to hand over to my colleague and very good, I'm very happy to be associated with her and to continue.
Okay, thank you for that, Nadya. Very heartfelt information you've passed on to us there, and I know it's not easy to do. Okay, so I wanted to talk about Obesity Empowerment Network. Obesity Empowerment Network is a non-profit charitable organisation formed as a user-led advocacy group for individuals affected by obesity. We consist of founding members, a strategic steering group, professional advisors and champions. We came about as a result of the discrimination and prejudice seen by Professor Rachel Batterham, who's spoken tonight, in her practice. So we live in a country where fatism is embedded in every layer of society, leaving people who are obese with no voice, no power to make themselves heard. OEN seeks to empower people living with obesity so they can be heard and, where necessary, to be their voice. So, I'd like to introduce you now to the steering group of Obesity Empowerment Network. As I said, Professor Batterham is the founding member and chair of Obesity UK. Dr. Jackie Doyle is founding member and the lead clinical psychologist. Professor Pinky Satora is Emeritus Professor of Nutrition and Childhood Obesity. Professor Sadaf Faruqi, Professor of Metabolism and Medicine at Cambridge University. Maggie Clinton there, founding member, a lead champion and former nursing lecturer. Nadya, who you've already met, she's an executive assistant and one of OEN's original champions. And of course, myself, I'm a former finance manager and OEN lead champion in Wales. So I've talked about who we are and how and why we came into being. Within the UK, it's been said that fatism is the last acceptable prejudice. You hear it every day, whether that's overtly in the use of stigmatizing words and actions, or covertly in the frameworks of organisations and institutions who often mostly, without realising it, impact and subscribe to the notion that there's a binary choice. This is heralded by that mantra, eat less, move more, that we've heard about so much tonight. That's all you need to do. Simple, isn't it? I hope those of us that are online this evening know that that view of obesity is outdated and destructive. Whilst environmental factors play their part, as we've heard, it's much more complex than that, and it has tentacles which slither and stretch out into every aspect of human life. To put it simply, it is a biopsychosocial issue. OEN's vision is dedicated to improving the health and the lives of people with obesity and overweight. And that is a significant number of people in the UK and across the world. So what does it look like? Our mission is to do this by working to eliminate weight bias and discrimination, to ensure that the voices of people with obesity are heard and they are treated with dignity and respect. The number of people with obesity that have been stigmatized, shamed and embarrassed, or just even made to feel uncomfortable because of their excess weight is eye-opening. 2 years ago, the All-Party Parliamentary Group on Obesity reported that 88% of those people that took part in the survey said they'd been stigmatized, criticized, or even abused because of their obesity. Skeptical? Don't be. People with obesity live under a plethora of negative stereotypes, leading to prejudice and discrimination. And what's more difficult is they're not always obvious to spot, albeit easy to psychologically damage. Obesity has been described, and I quote, as a burden on society, the greatest threat to the jewel in the British crown, our beloved NHS. Well, let's unpick that. To start with, we are dehumanized by referring to us as a disease and not as the human beings that we are. I'd like to say to those people who do this and who say that, you know, we are the greatest threat, learn to speak in people first language and please show us some respect. We, that is people living with obesity, are burdens. To me, that means that I'm an affliction, a cross which others have to carry. I am already feeling an outsider, and yet I'm made to feel that I'm the cause of worry and distress for others. And I and many other ordinary people living life the best way they can are made to feel that burden on others who are not overweight or obese. And they don't deserve my burdening them. I am part of a contingent that will cause the life-saving NHS to collapse. I will have to take my share of responsibility when the poor and the elderly die from preventable diseases because healthcare is no longer free at point of need. So I am obese and I am bad. Well, both of these comments are in fact nothing more than sound bites, straplines made by politicians who fear their own future popularity at the ballot box as a consequence of putting valuable resource into what is a chronic relapsing disease. Cancer research now tells us that 1 in 2 people will develop the disease, 50%. That's very scary. 65% of adults in the UK are overweight or obese, according to parliamentary statistics in 2019. Both can kill you. Both have scientifically developed evidence-based treatments available, but only one is regarded as a priority. Only one is unilaterally regarded as a disease. Only one talks about survivors, and only one is given the support required to beat it. So back to OEN. In another way we advocate is providing visible information regarding the standard of care that people with obesity should expect, the treatment options available to them, and a powerful understanding that obesity is a chronic relapsing disease, like heart disease, like cancer, and should be treated as such. Once again, our simple message is you are not to blame, and you can get help to treat your obesity. A recent global study carried out on the perceptions of people with obesity and healthcare professionals treating people with obesity has highlighted some very interesting points about the self-perception surrounding the disease. Whilst I can't go into details on the UK statistics at this point in time, one startling point is the delay incurred by people with obesity seeking help with weight loss from healthcare professionals. This is actually considerably longer in the UK to that shown for the global position. There maybe this is because of stigma, maybe it's because of the perceived stigma and the worry that healthcare professionals will have a negative attitude towards them. If the phrase, I don't know the answer to your question, but I know a person that does, that's quite true of us in OEN. We have a wide variety, an awful lot of people involved as professional advisors who we can seek information from. And we find that our voice is being sought by organisations such as Cancer Research, Obesity Health Alliance, the UK and the Welsh governments, and also international organisations such as EASO and Novo Nordisk. We're proud that along with other organisations across the UK, OEN is playing a significant part in changing the narrative around obesity. So our takeaway message to you tonight is I don't know anybody who truly wants to be obese. Yes, I know there's the body positive group that declare big is beautiful and there's nothing to worry about being obese, but they also deny the science behind obesity, often saying that the comorbidities we associate with obesity are not consequences of obesity, and that they put down to the fact that they're often developed by people who are not overweight or obese. Don't get me wrong, it's great to be warmly accepted and unconditionally accepted and celebrated for who we are. However, many of those people involved in that group are very young women who've yet to experience the consequences over the lifespan. The older we get, the more invasive it becomes. Everything is more difficult. It takes longer to do what you would normally do. Your energy levels are lower and everything hurts. And guess what? We've heard it once and you hear it again. Nobody takes you seriously. All of this stops people with obesity seeking help. Well, would you seek help if you felt the word was telling you it's so easy, you just eat less, move more? It's down to the way you live. It's your choices in life. It's your fault. So that makes me feel there's something wrong with me. Our own health minister, the ever helpful Mr. Matt Hancock, has broadcast to society people must take responsibility for their own weight. Well, I can assure Mr. Matt Bleep Hancock, if it were that easy, I would never have been obese in the first place. And I guess that's true for every obese person out there. So to conclude, what you can do, you can join us. You can speak up and speak out against the refusal of the decision makers to take decisive and clear measures to treat obesity. Lobby your members of parliament, write to the Prime Minister, the Health Minister, and anybody who makes decisions which negatively affect the lives of people with obesity and overweight. We all have a part to play in educating everyone about the complexity of obesity. Only then will we banish the embedded societal belief that people living with obesity are greedy, lazy, and deserve to be scorned. If you want further information or you know someone who might need our support, we can be contacted in any of the following ways.